Hi there, or Sadaf Qureshi here, and today we are going to talk about Norma Frontalis. So, what is Norma Frontalis? Norma Frontalis is anterior view of skull, and as you can see there in the diagram, this is the anterior view of skull. And today we are going to talk about what bones are visible from the anterior view of skull and what are important features on the bones that are visible from the anterior view of skull. And we will also talk about the articulations, some of the articulation of that bone. So first bone that is visible from norma frontalis, here you can see the diagrammatic representation, a pictorial representation skull. The color part is frontal bone. If we enlarge this, we can easily appreciate the superciliary arches that are just above the orbit. We can also appreciate the supraorbital foramen. It is a foramen that is present on the superior wall of the orbital cavity, and that's the reason it is called as supraorbital foramen. And we can also appreciate the upper margins of orbits are formed by frontal bone. Talking about its the upper area, it has frontal air sinuses that are basically the air-filled cavities and that act as vice resonator. Now let's talk about its articulation. We will see the frontal process of maxilla and nasal bone articulates with the frontal bone anterior inferiorly, and if we talk about the posteriorly, it articulates with the parietal bone, and anterior laterally frontal bone articulates with the zygomatic bone. Now let's talk about the second bone that is visible from anterior view of skull, that is parietal bone. So this the color part of the diagram or pictorial representation of skull shows the parietal bone. It is situated between the frontal bone, that is forehead, and the occipital bone, that is the back of head. And it is quadrilateral in shape with curved surfaces, and it articulates anteriorly with frontal bone, posteriorly it articulates with occipital bone, and anterior inferiorly it articulates with sphenoid bone, and anterior posteriorly it articulates with the temporal bone. Now let's talk about the next bone, that is temporal bone. The color part is showing the temporal bone. It is slightly visible from the anterior view and it is mostly visible from when we see the skull from the lateral view or norma lateralis. So it is superiorly articulates with the parietal bone. Anteriorly it articulates with sphenoid bone, and posteriorly it articulates with the occipital bone. Now let's talk about the next bone, that is the sphenoid bone. The color part here is showing the sphenoid bone. If we enlarge this image, we will see that it is situated in the middle part of the base of skull. It is butterfly shaped bone and it articulates with the frontal bone, it articulates with the parietal bone, and it articulates with the temporal bone and zygomatic bone. So this was about articulation. Moving to the next bone, that is lacrimal bone. The color part here you can see is the lacrimal bone. It is situated in the front part of medial wall of eye orbit. It articulates with the frontal bone superiorly, it articulates medially with the maxilla, and it articulates posteriorly and laterally with the sphenoid bone. Now let's talk about the next bone, that is nasal bone. The color part here is the nasal bone. If we enlarge this image, this is the nasal bone, and it forms the bridge of the nose. With the maxilla, it makes the anterior nasal aperture. Now let's talk the next bone, that is the ethmoid bone. There you can see this is the ethmoid bone. It is situated in the anterior part of cranial base between the sphenoid bone and frontal bone. It forms part of the medial wall of orbit. It also forms part of the roof of nasal cavity by its horizontal plates. It also forms part of the nasal septum that you can see there. This is the part there you can see that the middle part is forming the part of nasal septum. It has a cribriform plate, that is horizontal plate with the medial small opening or foramina that allow the passage of olfactory nerve from the nasal cavity to the brain. It also has another structure, important structure, that is crista galli, that is present just above the cribriform plate, and it can be appreciated when we see it from the cranial cavity base. It is a vertical projection that forms the cribriform plate that serves as the attachment point for the phallic cerebri. That is the membrane that separates the two cerebral hemispheres of the brain. It also has a perpendicular plate, that is a thin vertical plate that forms the superior part of nasal septum, dividing the nasal cavity into two halves. So it has three main parts: cribriform plate, a crista galli, and perpendicular plate. Now let's talk about the vomer. There you can see the color part here is showing the vomer. Vomer is situated in the midline of nasal cavity, forming the lower part of nasal septum. Superiorly, it articulates with ethmoid bone, posteriorly, it articulates with the sphenoid bone, and inferiorly, it articulates with the maxilla and palatine bone. Next bone we have that we can see from norma frontalis is Inferior conchi. There you can see the color part here is inferior conchi. It is situated along the lateral wall of nasal cavity, and it is below the middle and superior nasal conchi, which are the part of ethmoid bone. Next bone we are going to talk about is maxilla. There you can see this color part is maxilla. A maxilla contains maxillary air sinuses. There are air-filled spaces that are present in the bone and lined with epithelium, and they act as a visor center. Superiorly, maxilla articulates with the nasal bone and frontal bone. Laterally, it articulates with the zygomatic bone and alveolar. It also has another important process that is called the alveolar process, which has maxillary tree in it. It also has important foramina, that is infraorbital foramina, through which infraorbital nerve and vessel pass through. And next bone we are going to talk about, and that is visible from Norma Frontalis, is zygomatic bone. This is zygomatic bone. The color part you can see is the zygomatic bone. It forms part of lateral wall and floor of orbital cavity. As you can see there, it is forming the lateral wall and floor of orbital cavity. It forms the prominence of G, and it is superiorly articulated with the frontal bone. Inferiorly, it is articulated with the maxilla, and posteriorly articulated with the zygomatic process of temporal bone. Now let's talk about mandible. That is a really important bone for, especially for the dentist. So this color part here is showing the mandible. This we can see from our frontalis area. The mandible has two important parts. The first is ramus and the second is body. It also has another important part, that is alveolar process that harbors mandibular teeth. And it also has important foramen. We can see from Norma Frontalis, that is mandible foramen, through which ventral nerve passes forward. And there is an angle between the ramus and body that is called as angle of mandible. It is basically the point where ramus attaches to the body of mandible. It articulates with the skull with the temporomandibular joint, that is a mobile joint, while other joints in the skull are immobile joints. So this is a distinctive point for the mandible. Now let's revise all of these bones, and you will tell me what are these bones. The first bone we have there is frontal bone. This is parietal bone, temporal bone, sphenoid bone, lacrimal bone, nasal bone, ethmoid bone, vomer, inferior conchi, maxilla, zygomatic bone, and mandible. So these were all the bones that are visible from the norma frontalis. We will do its revision of, again, so that you can easily remember it. We have frontal bone here shown in purple color, parietal bone, temporal bone, sphenoid bone, lacrimal bone, nasal bone, ethmoid bone, vomer, inferior conchi, and maxilla, zygomatic bone, and mandible. So they are all the bones that are we can see or we can appreciate from the norma frontalis. Thank you for watching. Don't forget to like, share, subscribe, and comment.